An Irish study into vaping during pregnancy has been conducted at the Coombe Maternity Hospital in Dublin. The study is the first of its kind internationally and is published in the International Journal of Obstetrics and Gynecology. The lead author is Dr. Brendan MacDonald, the Bernard Stewart Fellow in the Coombe. I asked him why this research was carried out and what he found.
Vaping is something that we see a lot more of these days. It's something that's only been around in the last decade, but now we know about 4 to 5% of pregnant women vape. And this is something that's very new. We're used to smoking, we're used to seeing a decline in smoking, but vaping seems to be replacing some of that. There's been no research previously internationally on obstetric outcomes in pregnancy, so things like birth weight, gestation at delivery, whether your baby was sick when it was born. So back in 2017 we started to look at this and identify all the women who were coming through the Coombe who were vaping and look at their outcomes.
And what did you find?
So we found that in contrast to smokers who have a tendency towards having a low birth weight baby, which causes problems for baby during pregnancy, during delivery and after into childhood, we found that vaping women tend to have normal sized babies. So they have a much lower incidence of low birth weight compared to smokers. And in fact, their babies tend to be similar size to non-smokers.
And what is a normal size baby?
So an average term baby in Ireland is about 3.4 kilos, which is about 7.5 pounds. So if you're a smoker at term, your average size is about 3.1 kilos, which is just under 7 pounds. So the difference between being 6 pounds and 7 pounds is a difference between having problems in the pregnancy, having problems during the labour and delivery, or having problems that go on into childhood.
Are you saying then that it's safe to vape during pregnancy?
So saying something is safe in pregnancy takes many years of research. It takes follow-on studies which would follow these babies up into childhood and see is there any problems from, say, just nicotine exposure into childhood. And we don't have that data yet. What we do have is a large piece of the jigsaw in that birth weight is a major problem when it comes to smoking, and vaping women seem to have a normal birth weight baby.
So are you going to do further study and follow the children?
So in the Coombe, we're starting a study now to follow up babies of women who vape during pregnancy into childhood, to look for any problems with behaviour, to look for any problems with their neurodevelopment, and that's starting right now in the Coombe.
Much has been written over the past year or two about vaping here and in the United States. Can we say anything definitive about it yet?
So vaping in the States is very different from vaping in Ireland and the UK and Europe. In America, they have a totally unregulated product. People have been vaping cannabis oils, vitamin E acetate, and this is causing pneumonias, and there's been a lot of deaths in America, and we simply haven't seen that over here in Europe. And the reason why is that we have regulation here in Europe. We have a European Union directive regulating vaping, and we also, if you're a vaping manufacturer in Ireland, you're required to supply reports to the HSE on toxicology and things like that. So we haven't had as much problems over on this side of the Atlantic.
But because we don't have the longer term data yet, we cannot say that it is safe.
Yes, we can't say it's safe just yet. But this is an important step, I guess, in saying that they will have a normal birth weight baby.
What do you intend to do then with the results? So
in the UK, there's already some clinical trials going on looking at using vaping during pregnancy as a means of stopping smoking. We've pipped into the post a little bit with this data because we've shown that these women will have normal birth weight babies. Their studies, which are a bit larger, will give us more data into longer term follow-up of the babies afterwards. And then after this, we're going to be following up our babies as well to see is there any other issues in pregnancy, or is it something that is a method of harm reduction.
And just finally, how are we doing in getting pregnant mothers to stop all vaping and smoking? So
in the Coombe, we're at our lowest level to date for smoking in pregnancy. Currently, it's about 9% of women attending the Coombe are smoking in pregnancy. For many years now, we've been looking at smoking in pregnancy in the Coombe. We now have a specialist research service in the Coombe which offers supportive help to women to quit during pregnancy, because it's not easy and it's something that tends to be stigmatised and a little bit ignored. And we know that some women are ashamed to say that they smoke during pregnancy and then they don't get supports offered to them. So it's something that we look at very closely. It's something where the figures are getting nice and low, and we want to see those figures getting lower. This needs investment as well.
And that was Dr. Brendan MacDonald, the Bernard Stewart Fellow at the Coombe, speaking to me there about his